According to the White House government website, approximately 90% of Americans have some form of health insurance. However, this statistic shows that there are still people that need to be covered. Both Justice and I are entering the health field, so we think this is a very important community issue that will affect every single one of us. This will affect every single one of us because the Affordable Care Act requires all American citizens and legal residents to have health insurance. We believe that healthcare and health insurance, both individual and national, is essential for the protection and preservation of the citizens of the United States. Throughout this speech, we will be talking about individual and national healthcare, the problem in the United States, and how everyone can help themselves in respect to healthcare and insurance. Now, Justice will speak about the aspects of healthcare in the United States.
Okay, let's start with a couple definitions. According to the U.S. Census Bureau, they define health insurance as a means of financing a person's health care expenses. Healthcare coverage is defined as insurance that covers basic health needs. According to the Affordable Care Act, all U.S. citizens and legal residents require health care. Many people have private health care, but also others can have government health care. Approximately 90% of the United States is covered through health care, and about 65% of those people have private health care. Private health care can be provided through your employer or self-purchase, but many just get it through their employer. About 35% of those who are insured have a form of government health care. Now, government health care can be provided through many federal programs such as Medicare, Medicaid, the Children's Health Care Program, and multiple military health care programs, as well as individual state health care programs. About 50% of those who are covered by government health insurance use Medicaid, and the other 50% are scattered across the other multiple federal programs. Next, Vincent will be speaking about the problems with health insurance around the United States.
The United States, while having multiple types of insurance, as Justice mentioned, still has its problems. Even with such things as the Affordable Care Act, unnecessary procedures and inefficient care plague citizens of the United States. According to a Forbes article, unneeded health care accounts for about 1/3 of all healthcare costs, which equals billions of dollars. Additionally, in the same article, it is stated that 1 in 3 Medicare beneficiaries suffer some type of harm during their stay at a hospital. Not only that, but according to the CDC website, approximately 30 million Americans are still uninsured despite the reforms. Lastly, Justice will tell you how you can get involved in your healthcare.
There are multiple ways you can get involved in your healthcare. First is get insured, either through your employer, self-purchase, seeing if you qualify for Medicaid, or making sure your family member 65 plus apply for Medicare. These are all ways of getting yourself and others insured. The second is voting. All of us in this room are of voting age, so we all can get involved in this aspect. Go out and vote. Your vote truly counts. Go out and vote for government officials who are advocates for healthcare across the United States and advocates are improving healthcare and many different healthcare reforms. The more advocates we have in office whose goal is improving healthcare, the more healthcare will be improved across the United States. All of these are different things that you can do to further bridge the gap between the 9.1% of U.S. citizens who are not insured. And this brings us to our conclusion. Health insurance and healthcare is a vital part of protecting the citizens in the United States. We showed you this by highlighting healthcare, individual and national, explaining the problem in the U.S., and also how you can get involved.
We would now like to implore everyone in this class to invest in your own healthcare, to vote for proponents of health reform, and be active to protect yourself both physically and financially. To close, I would like to share a quote. As stated by President Barack Obama in 2013, In the wealthiest nation on earth, no one should go broke just because they got sick.